Hello, friends. I'm Professor Smita Jha from the Department of Humanities and Social Sciences, and I'm doing the course Health and Disability in Humanities. Now, this is the topic titled Introduction to Histories, Theories, and Methods in Medical and Health Humanities. You know that medical or health humanities is an emerging area in the field of humanities research. So it is the high time to know about the definition of health and then disability, and also the trajectory, the various phases, theories, and methods that we adopt while understanding medical and health humanities. So let us discuss medicine in the classical period, because medical humanity is not a new thing. Right from the ancient time, we have the instances of the discussion on medical humanities, the medicines, the classical medicines. So during the classical period between the 5th and 4th centuries BCE, doctors had a more holistic view of medicine than they do today. When someone was sick, doctors recognized that the condition was related to the whole person. Therefore, treatment also involved caring for the whole person. Whole person means the entire personality, the whole, the pathological system. And during this time of antiquity, Hippocrates, you must have heard the name of Hippocrates, a physician of the classical period and the father of modern medicine, believed in humoral medicine. According to this model, good health reflected the four humors, namely black bile, yellow bile, phalgum, and blood, that should be kept in equilibrium, that is, in balance. According to this model, if you become sick, this indicated that your humors were imbalanced, to which a doctor might suggest an intervention like bloodletting or prescribe a lifestyle change, such as an alternation in diet or occupation. This is all to say that in antiquity, health was understood as a balancing act between internal and external components, that is, psychological and physical components, and as existing within a wider environmental and sociological context. This influence of humorism on Western medicine persisted for over 2 millennia. In the classical period, for attaining an education to become a doctor, the oldest and perhaps the most prominent medical school in modern civilization was the School Medica Salernitana. This medical school based its curriculum around Hippocratic medical doctrine, as discussed earlier. Based in Salerno, Italy, this school was at the forefront of medical education in early modern Europe. In addition to anatomy and medical theory, students learned Greek, Latin, and philosophy in order to appreciate classical text in their original language. Later, in the 12th century, students were also taught grammar and rhetoric. The fame associated with the Salerno School of Medicine suggests that it successfully served as a model for other educational institutions of that period. As a result of the school's integrated curriculum, including anatomy, medical theory, as well as grammar and rhetoric, doctors throughout Europe started studying the humanities as an integral part of their medical training. However, despite the emergence of early humanistic influences, the primary focus of studying medicine was towards a greater understanding of the body and of the origins of disease. Thus, the study of medicine became a science primarily. focusing on medicine as a science. By 19th century, the work of Giovanni Battista Morgagni, Xavier Bichet, and Rudolf Virchow developed pathology as a specialism locating disease within tissues and cells. Microbiology also became prominent, with Louis Pasteur's germ theory, published in 1861 and advanced from Robert Koch. Over time, our understanding of disease thus became far more localized. We could now pinpoint specific organs, tissues, even cells causing illness. Consequently, the study of medicine became highly specialized. Physicians could devote themselves to the mastery of a particular medical discipline, dividing labor among specialists and advancing knowledge and medical teaching. Medical education as a whole prioritized scientific knowledge and advancement in the education and ethos of the physician. This approach galvanized medical science in the US, but its detractors feared that the primary role of the physician was being lost. Osler, a significant opponent, believed that the care and welfare of the patient were being decentered from the aims of medical profession. Despite its opponents, medical specialization continued to progress into the 20th century. This progress was in part propelled by the Flexner Report in 1910. This American report transformed the landscape of medical education in the US, advocating a biomedical model of education inspired by the success of German institutions. Coming to the emergence of medical humanities, I would say that fast forward to the 1960s and 70s, and we begin to see the re-emergence of humanities disciplines in medical curricula. In 1967, Pennsylvania State College of Medicine opened the first department of humanities in a US medical university. In the UK, United Kingdom, there was a drive for medical ethics to be reintroduced to MD education through forums such as the London Medical Group, aimed at balancing scientific training with ethical, humanistic perspectives. A confluence of factors and events beckoned the return of the humanities to medicine at that particular time. There is no scope right now to go into the depth, but here are a few headlines. In the aftermath of the Second World War, the Nuremberg trials revealed evidence of human experimentation of Nazi doctors. Repeating these atrocities was to be avoided at all cost. After the atomic bombings of Hiroshima and Nagasaki, there were debates about the social responsibility of science concerning ethics and the potential perils of new technology. With other conflicts, such as the Korean War and particularly the unpopular Vietnam War, there was a feeling that leaders and institutions should be made accountable for the consequences of their action. Furthermore, there was also a rise in social activism and political debate. Social movement such as the civil rights movement, feminist movement, and gay liberation movement marked this period as one of great social change. Previously established social hierarchies were being challenged, and with this, the traditional differential attitude to the doctor were also questioned. Public debates on abortion in the United Kingdom and the United States of America raised moral issues with the procedure, as did attempts to legalize euthanasia. Medical and technological advancements such as organ donation, genetic coding, and reproductive technology pushed the limits of science and introduced new moral debates. See the various development that raise, different kind of debates. And this is how the new era, different phases emerge in the area of medical and health humanities. These include concerns that medical technology further dehumanized medical practice. Institutionalized medicine had changed the doctor patient dynamic. Many of these concerns were raised by Edmund Pellegrino in his 1973 book titled The Hippocratic Ethic Revisited. In this piece, which is considered a manifesto for the medical humanities, Pellegrino described how the complexities of modern life required a renewed consideration of medical ethics and the importance of humanistic medical training. Society had changed. What it meant to be a doctor had changed. Consequently, professional ethics needed to change as well. As a consequence of these changes and evolutions to include ethics in the education of medicine, medical and health humanities emerged as an interdisciplinary field that combines art, literature, history, and philosophy with health education. It aims to enhance patient care and deepen the understanding of the experience of illness. This field originated in the 1960s and 1970s as a response to the rise of technical medicine. Today, it emphasizes empathy, social justice, and critical analysis, shifting the focus from purely clinical aspects to broader social determinants of health. Now, let us know about the expansion of medical humanities. The 1970s marked a shift towards analyzing the social and cultural aspects of medicine rather than just its development. The field shifted from medical humanities that often focused on clinical empathy and doctors to health humanities, which covers a broader scope, including public health, societal narratives, social justice, and patient communities. If I discuss health humanities from medical service to social critique, this will again strengthen the discussion that we are going to have. Health humanities has shifted from being a supportive tool for doctors to a standalone field that critiques the entire healthcare system. It has evolved through the following phases. Let us see what are the phases. The medical phase from 1970s to 1990s, originally called medical humanities, the focus was on using literature and art to make doctors more empathetic and well-rounded. Emerged in the US as a response to the over medicalization of healthcare. The goal was to rehumanize medical education. Then the health unquote pivot 2000s present, the term shifted to health humanities to be more inclusive of non-physicians such as nurses, patients, and allied health professionals. It moved from a disease-centric view, how to fix a body, to health-centric view, how people live with illness. In the 1990s, scholars like Rita Charon introduced narrative medicine, emphasizing that doctors need to understand the stories patients tell, not just their symptoms. Then the current wave, underquote, critical medical humanities, now examines how power, race, and economics, not just biology, determine who gets to be healthy. Now, see the corpus, the vast corpus of health humanities. Recently, the field shifted from medical humanities that was focused on doctors to health humanities that focused on broader look at public health, disability, and social justice. Because we talk of ethics too much in health humanities. Now, what are the core theories of health humanities? This is the most prominent aspect to know about to understand health and disability. Disability humanities, if we talk the trajectories of health humanities and disability humanities have evolved from specialized subfields of medical education and civil rights into broad critical disciplines that challenge how we define normal and healthy. Then biopsychosocial model, moving past the biological machine view to include psychological and social factors. Social constructionism, the idea that illness is defined by culture. For example, how society viewed hysteria in the 1800s versus mental health today. Then comes posthumanism, exploring how technology, that is, artificial intelligence, prosthetics, and the environment redefine what it means to be a healthy human. Critical theory, examining how power, race, and gender influence who gets care and how they are treated. See, in any research area, critical theory plays a pivotal role because critical theories are a kind of lens that gives you the deeper insight into a particular study. So, critical theories in medical or health humanities are very, very important. Now, we may discuss this in the coming discussion. So, disability humanities from cure to culture. Disability humanities emerged from the disability rights movement of the 1960s and 70s, moving away from viewing disability as a broken state that needs fixing. The transition from medical to social model of viewing disability went through various stages, such as the social model shift. The field's major trajectory was moving from the medical model that viewed disability as a biological problem in the individual to the social model that views disability as it is caused by a world that is not built for everyone. Expansion of identity. Early work focused mostly on visible physical disability. Modern disability humanities now includes invisible disabilities, neurodivergence, chronic illness, and mental health. You see the different names. In fact, medical humanity deals with chronic illness. And these chronic illness in plural have several names, and disability is one of them. Disability as culture. Scholars now treat disability as a unique cultural identity and a source of knowledge rather than a deficit. Now, you might wonder then about the intersection where disability humanities and health humanities meet. These two fields of disability humanities and health humanities are increasingly entangled in the following aspects. Now, what are the aspects? Uh, Let us discuss that. Firstly, in challenging normalcy, both fields work together to deconstruct the idea of a normal body, arguing that what we call normal is actually a social construction used to marginalize people. Secondly, in promoting a joint advocacy in modern medical education, including new curricula in countries like India, health humanities tools like storytelling and film are used specifically to teach disability competencies. to future healthcare providers. Thirdly, in addressing the idea of ableism, disability humanities provides the critical edge that prevents health humanities from becoming too focused on curing and instead focuses on caring and accessibility. Now we come to the second core theory of health humanities, that is the biopsychosocial model. Let us see what is biopsychosocial model. The biopsychosocial model is a holistic framework that explains how health and illness result from the complex dynamic interaction of biological, psychological, and social factors. Introduced by psychiatrist George L. Angel in 1977, biopsychosocial model was designed as a new medical model to challenge the then dominant biomedical model, which viewed disease solely as a result of physical or chemical malfunction. You see in the graph that biological, genetics, disease, injury, hormone, diet, exercise, drug, toxin, stressors. Then social, that is upbringing, family, peer relationship, poverty, school, media, culture, work, stresses, traumas, discrimination. Coming to psychological, belief, emotion, resilience, coping skills, emotional intelligence, cognitive biases, behavior, and intelligent quotient, that all become mental health. Now, let us know about the key components of biopsychosocial model. Biological focuses on physical health, genetics, brain chemistry, immune function, and organ health. For example, a person may have a genetic vulnerability to a specific disease. Psychological includes thoughts, emotions, and behaviors. Mental processes such as coping strategies, personality traits, and stress responses can significantly influence the onset and progression of illness. Third, social examines environmental and cultural factor, including family support, socioeconomic status, employment, and access to healthcare. See, we are discussing biopsychosocial theory. So see, biological, psychological, and sociological. Now, practical applications of biopsychosocial model. The biopsychosocial model is used across various medical and psychological disciplines to provide more effective patient-centered care. Firstly, the chronic pain management. It recognizes that pain is not just a physical sensation, but is also shaped by patients' emotion and social support. Secondly, the mental health treatment. It is used to understand and treat disorders like depression and anxiety by addressing biological and predispositions alongside life stressor. Thirdly, for addiction recovery, it considers genetic risk factors, psychological triggers, and social environment to create comprehensive treatment plans. Now, the 4P model of case formulation in biopsychosocial model. What are these? Predisposing factors that include underlying vulnerability, that is genetics. Participating factors that include immediate triggers, that is a major life stressor. Perpetuating factors include factors that contribute to the persistence of the problem, that is, lack of social support. Then, protective factors include strengths that aid recovery, and, for example, strong coping skills. That is all for this lecture. In the next one, we will take a look at the next core theory of health humanity, that is social constructivism. If you recall, I discussed briefly in the previous lecture of mine when I was preparing the ground, the base for medical, health, and disability humanities, because theories are important to understand the various aspects and parts of the development that take place in the area of health humanities and medical humanities. And as I said, that ethics, which is an important part of health humanities, talking about law and justice. Well, these are all important theories explaining the nature of health humanities, disability humanities. With this, I wrap up the discussion. Let us meet in the next discussion with a new topic.